Relationships and Borderline Personality Disorder, BPD, how BPD affects family and romantic relationships. Borderline Personality Disorder, BPD, is often associated with significant challenges in relationships, both with family members and romantic partners. The intense emotions, fear of abandonment, emotional instability, and impulsivity that characterize BPD can create a turbulent emotional landscape for both the individual with BPD and their loved ones. These difficulties can lead to misunderstandings, conflict, and emotional distress, making it hard to maintain stable, healthy relationships. In this episode of the Borderline Personality Disorder, BPD, podcast, we will explore how BPD affects family relationships and romantic partnerships, the challenges individuals with BPD face in these relationships, and how both the individual and their loved ones can work together to improve communication, trust, and emotional stability. How BPD affects family relationships. Family relationships can be significantly impacted by the symptoms of borderline personality disorder. The emotional volatility, impulsivity, and sensitivity to perceived rejection experienced by individuals with BPD often create an atmosphere of tension and instability within the family. Here are some of the ways that BPD can affect relationships with family members. 1. Intense emotional reactions and mood swings. Individuals with BPD often experience rapid mood swings and intense emotions that can seem disproportionate to the situation. For example, a small disagreement may trigger overwhelming feelings of anger, sadness, or fear. These extreme emotions can lead to outbursts, shouting, or withdrawal, which can be difficult for family members to understand and respond to. Impact on family dynamics. Family members may feel confused, frustrated, or exhausted trying to navigate these intense emotional shifts. It may feel impossible to predict how the person with BPD will react in any given situation, making family interactions feel unpredictable and stressful. 2. Fear of abandonment and rejection. A hallmark symptom of BPD is an overwhelming fear of abandonment. Individuals with BPD may interpret neutral or ambiguous situations as signs that they are being rejected or abandoned. This fear can lead to behaviors such as clinging, testing boundaries, or emotional withdrawal as a way of protecting themselves from perceived rejection. Family strain. The constant need for reassurance and the heightened fear of abandonment can put a strain on family relationships. Family members may feel trapped or burdened by the constant emotional demands and may struggle with how to provide support without feeling overwhelmed. 3. Idealization and evaluation. Splitting. One of the more complex aspects of BPD is the tendency to engage in splitting, or idealizing someone one moment and then devaluing them the next. This can happen quickly and often without clear reason. The person with BPD may perceive family members as perfect or all good one moment and then see them as flawed or untrustworthy the next. Family members feel unappreciated. Family members may feel hurt, confused, and rejected when they are devalued, especially after being idealized. This constant shifting in perception can lead to a lack of trust and emotional exhaustion within the family dynamic. 4. Difficulty with boundaries. Individuals with BPD may struggle with setting and respecting boundaries, which can lead to intrusive or overly dependent behaviors. They may feel the need to cling to family members for reassurance or may have difficulty respecting the personal space or needs of others. Boundary violations. Family members may feel overwhelmed by the constant emotional demands, feeling like they cannot maintain healthy boundaries or have their own space. This can lead to resentment and emotional burnout. 5. Miscommunication and conflict. Communication can often be difficult in families where one member has BPD. The person with BPD may feel misunderstood, invalidated, or attacked during conflicts, leading to an escalation of emotions. This can make problem solving and conflict resolution challenging. Escalating conflicts. Small disagreements may quickly escalate into heated arguments, with family members struggling to de-escalate or resolve the situation. The constant cycle of conflict can lead to feelings of frustration and hopelessness for both the individual with BPD and their family members. How BPD affects romantic relationships. Romantic relationships can also be deeply affected by borderline personality disorder. The patterns of emotional instability, idealization and evaluation, and fear of abandonment that are characteristic of BPD often create significant challenges for both partners. Here are some of the ways that BPD impacts romantic relationships. 1. Fear of abandonment and clinginess. As in family relationships, the fear of abandonment is a major issue in romantic relationships for individuals with BPD. This fear can lead to clingy or dependent behavior, where the individual constantly seeks reassurance from their partner or becomes anxious about being rejected. Overdependence. The person with BPD may demand constant attention or validation, leading their partner to feel emotionally drained or overwhelmed. This dependence can strain the relationship and create an unbalanced dynamic where one partner feels responsible for the other's emotional well-being. 2. Intense emotional reactions and conflict. In romantic relationships, the intense emotional reactions associated with BPD can be particularly disruptive. A minor disagreement may quickly escalate into an emotionally charged argument, and the individual with BPD may react with anger, sadness, or even rage. These emotional outbursts can cause significant strain and create a volatile atmosphere in the relationship. Emotional instability. The lack of emotional stability can create an environment where the person with BPD is frequently upset, and their partner may feel confused, helpless, or frustrated about how to respond to these shifts. 3. Idealization and evaluation. Splitting. As mentioned earlier, individuals with BPD often engage in splitting, where they rapidly shift between seeing their partner as perfect or all good and then as flawed or untrustworthy. This can create extreme emotional ups and downs in the relationship. Emotional roller coaster. The partner may feel like they are constantly on an emotional roller coaster, where one moment they are being showered with love and affection, and the next they are being criticized or rejected. This can create a sense of confusion and insecurity for the partner, who may struggle to understand why their behavior is being perceived so differently. 4. Difficulty with boundaries and independence. The person with BPD may struggle to maintain a healthy sense of independence in the relationship, often relying on their partner for constant emotional validation or support. This can lead to a blurring of boundaries and an unhealthy dynamic where the individual with BPD feels enmeshed with their partner. Stifling autonomy. Partners may feel like they are unable to have their own space, and they may feel suffocated or overwhelmed by the demands of the person with BPD. This can lead to resentment and relationship fatigue. 5. Self-sabotage and fear of intimacy. Because of the fear of abandonment and the overwhelming need for reassurance, individuals with BPD may self-sabotage their romantic relationships. They may push their partner away before they are rejected, often engaging in behaviors that are destructive to the relationship. Pushing away love. The person with BPD may test their partner's love by creating conflict or pushing them away to see if the partner will stay. This can create a vicious cycle where both partners feel insecure and trapped in the relationship, even though they may deeply care for each other. Strategies for improving relationships with BPD. While BPD can create significant challenges in both family and romantic relationships, there are several strategies that can help improve communication, build trust, and create healthier relationship dynamics. 1. Therapy and treatment. Therapy is essential for both individuals with BPD and their loved ones. Dialectical behavior therapy, DBT, which focuses on emotion regulation, distress tolerance, mindfulness, and interpersonal effectiveness, is one of the most effective treatments for BPD. Couples therapy or family therapy can also be beneficial in improving communication and addressing relationship challenges. 2. Building healthy boundaries. Establishing and respecting healthy boundaries is essential in any relationship, especially when one partner has BPD. Family members and romantic partners should learn to set limits on the emotional demands they can handle while still offering support and compassion. The person with BPD also needs to learn to respect boundaries and manage their emotional needs more effectively. 3. Validation and communication. Validation is critical in relationships where one partner has BPD. Acknowledging and empathizing with the person's emotions, even if they seem intense or irrational, can help reduce emotional reactivity and promote emotional safety. Effective communication involves active listening, emotional validation, and assertiveness in expressing needs without becoming defensive or overwhelmed. 4. Self-care and stress management. Both individuals with BPD and their loved ones should prioritize self-care and stress management to reduce emotional reactivity and prevent burnout. This includes regular exercise, mindfulness practices, and seeking support through individual therapy, support groups, or peer networks. Conclusion. Borderline personality disorder, BPD, can significantly impact both family and romantic relationships, creating challenges related to emotional instability, fear of abandonment, idealization and evaluation, and difficulty maintaining healthy boundaries. However, with the right tools and support, individuals with BPD and their loved ones can work together to improve communication, emotional regulation, and relationship dynamics. Therapy, mindfulness, validation, and boundaries are key components in creating healthier, more stable relationships. It is essential for both individuals with BPD and their families or partners to be patient, compassionate, and committed to making positive changes. In future episodes, we will continue to explore how individuals with BPD can build stronger relationships and manage their emotions effectively. Stay tuned for more insights into borderline personality disorder and its impact on relationships.